Great hearing health relies heavily on the provider. If the provider is not following best practices, you may not be hearing at your very best. Here are some questions to ask before you make your first appointment. First, does the office provide speech and noise testing? This should be done on anyone interested in getting hearing aids. A baseline or basic hearing evaluation does not give me any information on how your brain is able to process speech in noisy environments. A speech and noise test helps us to determine which level of technology is most appropriate for you, as well as realistic expectations when you are at a restaurant. Second, does the office follow a proven treatment process that includes regular follow-up visits and annual hearing tests? If they tell you, call me if you have any issues, run away. Routine maintenance is necessary to keep your little electronic device functioning well, and annual hearing evaluations are needed to ensure you are always hearing at your very best. As your hearing changes, we need to change the programming of the hearing aid. Third, relates to individualized hearing aid fittings. Does the office provide custom hearing aid settings based on your hearing loss, lifestyle, and preferences? Do they provide education about your hearing loss, the function of the hearing aid, and realistic expectation for improvement? What about communication strategies? They should be teaching you effective techniques to improve your hearing in challenging situations. Fourth, does the office do real ear measurements? This is a way to verify the hearing aid performance and validate that the hearing aids are programmed accurately for your hearing loss. If this is not being done, we don't actually know if the hearing aids are programmed as best as they can be for you. This is a non-negotiable. And finally, fifth, do they perform electroacoustic test box measures? So what exactly is a test box measure? Well, it's basically a tiny soundproof room where we can test your hearing aids to make sure they are working perfectly. Think of it as like a fitness test for your hearing aids, making sure they're in tip-top shape to help you hear your best. Why does this matter? Well, these tests ensure that your hearing aids not just amplifying sound, but doing so in a way that's right for your specific hearing loss. It's the difference between hearing sort of okay and hearing, wow, this is amazing.